Hello, good afternoon. My name is Dr. Chudi Ufundu of Snowspirations Global Health Solutions. And today it's the first day of July 2023. Amazing day, amazing Saturday, an opportunity to start a new month on a fresh note. Now, what other topic can we discuss today if not ovulation? Remember, the basis for becoming pregnant is ovulation. So today we're going to talk about ovulation. We're going to talk about the ways you can confirm you are ovulating. So it's going to be huge. It's going to be straight to point. It's going to help you to pinpoint what ovulation is all about and the things you can focus on, which will help you to confirm if you are ovulating, so you can be conversant with the steps you need to take to become pregnant. Ovulation is huge because without ovulation, you can't become pregnant. Just like without producing the sperm, pregnancy will not happen. So ovulation is very important for all women who are believing God for babies. So I want you to sit back. I want you to quickly announce your name, announce your location. Then I'm going to spend about less than 10 minutes to explain the concepts you need to be very, very aware of. Then after that, you will have an opportunity to ask your questions. Remember, every Saturday about this time, we normally show up with a topic that will benefit you. So today we're talking about ovulation. Before you leave today, make it a point of duty to subscribe. So subscription for YouTube simply means clicking on those icons, setting your notifications so that anytime I come live, they will notify you that I'm currently live. COO is in attendance, so COO is going to help you if you have any need. I also want you to click on the share button and make sure that anyone that needs to know about ovulation is in the clinic now. Immediately after this clinic, I'm going to repeat exactly the same clinic in our Facebook. So if you're not able to participate in YouTube, don't worry about it. Join me in Facebook. We're going to spend about 30 minutes and we're going to understand it better. It's important to follow my teachings today because if you do, it's going to help you in so many huge ways to understand what you need to be looking out for regarding ovulation. And I'm going to start. So anytime we talk about ovulation, it simply means the process of releasing the eggs that God already gave you. So ovulation simply means the process that go on before you release the egg from any of the ovaries. That's what ovulation is all about. Ovulation is under the control of reproductive hormones. So there are so many hormones that will definitely work together before you release the egg. I'm going to mention them. Number one is estrogen. Number two is FSH, follicular stimulating hormone. And number three is LH, luteinizing hormone. These are the basic ones. The other reproductive hormones must also be within normal range for pregnancy to fully happen. But the three hormones I mentioned are the cardinal hormones that will aid in the process of releasing the eggs. It's important to understand that as a lady in your reproductive phase of life, you already have the eggs. So the problem is that you don't have the eggs. The eggs are already there, so long as you haven't entered menopause. But we want the eggs to be released. So the whole processes that happen before you release the egg is all about ovulation. Now, there are some signs and there are some symptoms of ovulation which are non-specific. Non-specific means you might have them and you are ovulating, or you might have them and you're not ovulating. So it's not fixed. So some women will notice that by the time they are ovulating, they are spotting. Some women will notice mid-cycle pain, and commonly some women will notice increase in the cervical mucus. Some women will be constipated. Some women will notice increase in libido. Some women will notice bloating. Some women will notice breast tenderness. They are all non-specific. So non-specific means you can have all these symptoms and signs. It might be a sign that you might have what we call PMS or other gynecological problems. But what I'm going to take us through, it's about the basic things you can actually track, and it can help to confirm if you are ovulating or not. I'm going to mention them in the order of importance. The first one is your menstrual diary. I've always encouraged every woman in this community that want to have a baby to keep a menstrual diary from January to December. In your diary every month, I want you to remember the first day you bled every month and the last day you bled every month. So remember your average bleeding, it's from 2 to 7 days. So if you go to January, you mark the first day you bled in January, you mark the last day you bled in January, you repeat the same for February until December. When you do this, you can have an idea of your diary. You can have an idea of your trend. So if you have a regular predictive cycle, especially if you're younger than 35, we can use that cycle to pinpoint the likely period you're ovulating. So the average out there, it's from 21 to 35 days. That's the average normal cycle. So assuming you have a 28-day cycle, and we apply factor 14 based on your diary. So you can have little variations of 28, 29, 30. It's still going to give you 28.9, which is 29. So if you have that variations and you apply factor 14, then on the 14th day, if you begin to count the first day you bled, will be the day you will likely ovulate. So we normally use the menstrual diary to give us a kind of concrete evidence-based approach to the likely period you are ovulating. But the criteria for this is regularity. If you have irregular, unpredictable cycle, it will be difficult to apply your menstrual diary. So if you know you bleed every 28 days, every 30 days, every 25 days, then you can keep your diary. We can use your diary to plot when you will ovulate. That's number one. Number two, use of your basal body temperature. Everybody can do this. Your BBT, your basal body temperature, is the temperature of your body when you're in a resting mode. We encourage you to measure your temperature just about from day 10 of your cycle. So you measure it the first thing in the morning before you come out of bed. Every woman has an expected temperature when she is in a resting mode. Now, when you begin to plot this from day 10, by writing the temperature down, it will be helpful to give us an idea of when you ovulate. Because when you ovulate, shortly after ovulation, your temperature will drop. Then immediately after ovulation, your temperature will rise. Now, this is very important. If you just do it regularly, you can know the pattern. So, for example, before ovulation, your basal body temperature will fall to the lowest by about 0.4 to 0.8 degrees Fahrenheit. Then after which, 2 to 4 days after ovulation, it will rise. So if you pay close attention to your body, whenever your basal body temperature goes up, you will feel it in your body. You will feel like you're having a little fever. This works. Measurement of your basal body temperature. If you have your thermometer at home, you can use this to know when you have elevated basal body temperature, which will tell us you are actually ovulating. Okay, so we need to know all this so that we can apply it by ourselves. So use of your basal body temperature is also important to help us to pinpoint the likely period you are ovulating. So that's method number 2. Method number 3 is what majority of people are using, especially in this dispensation: ovulation predictor kits, OPK. What we are actually looking for in ovulation predictor kit is actually the level of rise in the luteinizing hormone. So remember, I mentioned follicular stimulating hormone, luteinizing hormone, and estrogen. So these are the 3 basic hormones we can use to predict if a woman is ovulating or not. Now, if you have a regular predictive cycle, it's expected that shortly, about 24 hours before you ovulate, you will have a spike in the level of your LH. When you have this spike in the level of your LH, it's expected that after 24 hours, you will ovulate. So anyone currently using ovulation test kit is actually checking for the surge in LH. It's called LH surge. Now, you use your urine to measure this. We normally start from day 10. And we normally encourage you to measure it around the afternoon or early evening, because that's when you have the highest level of LH in your urine. This also works. Now, the other method of checking to confirm if you're ovulating or not is to check your cervical fluid. Your cervical fluid changes. So expectedly, when you are about to ovulate, the level of the quantity of your cervical mucus will increase, and they will actually be like egg white. They will be wetter. Okay, so you will notice it will be slippery, it will be more wet about that time you're about to ovulate. So when you see a shift from your cervical discharge to being wet and slippery, that's about the time you're ovulating, because shortly after ovulation, when the level of progesterone goes up, they will begin to be dry. So if you can tie all these things together, you will notice that there is this particular time in your cycle, you notice an increase in your cervical mucus, and they feel like they are slippery, they feel like egg white. That's also a proven way of knowing if you are ovulating. It works. So you can keep an eye on this. Now, another method which we are going to do by collecting your blood sample is to check for your progesterone. We normally will want to check the progesterone at day 21. Progesterone is a hormone that is produced shortly after the egg is released. And, it's a hormone that is made after ovulation, and the idea of progesterone is to maintain the lining of your uterus, which is the endometrium, so that pregnancy will proceed appropriately. Now, most times from the first 10 weeks of pregnancy, the level of progesterone will go up, because there is a particular thing that forms once pregnancy is confirmed. It's called corpus luteum. Corpus luteum is responsible for producing the progesterone. Corpus luteum, it's a couple of things that will be produced around that, whole follicle that will release the egg. So checking your progesterone, especially at day 21, it's also very helpful in telling us if a woman is ovulating. Now, lastly, pelvic ultrasound. So when we go for pelvic ultrasound, which will definitely do transvaginally, when we put a probe into your vagina and we take a look at the ovaries, after ovulation, you will notice the presence of corpus luteum. Corpus luteum, it's normally out there to nourish the egg, which is the oocyte, which the sperm needs to fertilize. So when we run an ultrasound, we can detect the presence of corpus luteum in the ovary. That's also a sign you might have ovulated. So this particular sequence of tests we can use are the things we normally employ to confirm if a woman is ovulating or not. So pelvic ultrasound, testing the progesterone at day 21, making sure the cervical mucus is just, slippery and like egg white consistency, checking the level of LH in your ovulation predictor kits, checking your basal body temperature, and of course, making sure you keep your menstrual diary. So these are the practical things you can do by yourself to know if you are ovulating or not. If you're so sure about the outcome, then ovulation is taken care of. But remember that pregnancy involves a lot of other complex processes. Okay, so that's my presentation. I'm going to quickly allow us to start asking our questions. So please, if you have any questions, feel free and ask, and I'll provide you feedback. It's time for questions. Please ask your questions. Okay, it's going to be pretty straightforward. I can see only a few people are in the clinic. If you have any specific questions regarding this ovulation teaching, please ask, and I'll provide you feedbacks immediately. Please feel free and ask your questions very quickly. COO, if you have anyone you can ask, maybe we can just use it to teach before I'm actually going to round up at the 15-minute mark. Any questions? Okay. Should believing for baby couples be concerned about ovulation? Of course. We must confirm you are ovulating, because if you're not ovulating, it's a waste of time. Remember, the egg must be there, the sperm must be there. So once we confirm you're not ovulating, then every other thing we're doing is wasteful. So imagine if you're not ovulating, but you're spending all the money going up and down, then where's the egg that the sperm will fertilize? So ovulation is very important. Thankfully, for most women, if we confirm you're not ovulating, we can give you ovulation induction drugs. So there are some oral drugs we can give you to stimulate the ovaries to release the eggs. So ovulation is very, very important. Once a woman is not ovulating, we are worried. Now, unfortunately, some women can have an ovulatory cycle simply because we've had ovarian insufficiency or early menopause. Once it's confirmed you no longer have eggs, there is no magic we're gonna do. You're just gonna use donor eggs. But if you have the eggs there, but the problem is that you're not releasing them, then we can give you ovulation induction drugs, which you go to the ovaries and tell the ovaries to release all the eggs. So yes, believing for baby couples must be worried about ovulation. If you're not ovulating, that's a big problem. Very big problem. I love that question. Do we have more questions, please? Please, if you have more questions, feel free to ask before I end. What about timed ovulation lovemaking? How important is that? Now, under the supervision of a fertility specialist, we can actually confirm that the woman is in a good place, and we can actually confirm that the man actually has quality sperm. In that case, we can monitor the ovulation timing, and we can tell you to have timed lovemaking. This is under the supervision of a fertility specialist. So that can be applicable if you are under management, but by yourself, we don't encourage timed lovemaking. The problem is some women might think they are actually ovulating and they might not be ovulating, and they will be timing wrongly. But if you're under the care of a fertility specialist, we can run all these tests I mentioned and confirm that you actually have eggs, and we can actually predict the time you're likely going to ovulate. So if we have that, then we can have your fertility window. So under the care of a fertility specialist, and we know that this lady is going to ovulate in the next 5 days, then we can tell the couples to increase the frequency of their lovemaking within about that few days before the 5 days. So the answer is yes. If you are under close monitoring, and if you're under the management of a fertility specialist, we can tell you to have timed lovemaking based on the fact that we've studied your body, or we have actually taken over your body to predict when you're going to ovulate. Then we can bring the sperm, because once we have availability of the sperm and the egg, pregnancy will happen if every other factors are taken care of. I love that question. So personally, by yourself, we don't encourage timed lovemaking based on ovulation, but if you're under the care of a fertility specialist, it's highly encouraged. If you're not under the care of a fertility specialist, we encourage you to make love every other day. Okay? Now, it's 17 minutes and few seconds. Maybe I can just hang around to run it up to 20. So if you still have any questions, feel free to ask. It looks like it's only me and COO, which is fun. Any relationship between ovulation and gender of the baby? This is a very technical question, and I'm going to answer it the best way I can. Now, some school of teachings believe that ovulation and the timing of lovemaking can actually predict a particular gender of a baby. However, it's anecdotal and it's not strong because there are so many variations. But supposedly, when a woman engages in lovemaking within a particular time related to the ovulation, she can actually have a baby boy based on the fact of the nature of the male dominating and producing sperm. Remember, it's actually the man that determines if a woman will have a baby boy, a baby girl. The difference is the Y chromosome. So Y chromosome is the baby boy predicting gene. The X chromosome, it's the chromosome that a woman will have after all. So a woman will have XX chromosome, whereas a man will have XY chromosome. So depending on what the man is bringing to the table of making a baby, if the man brings the Y chromosome, then it's going to be a baby boy. If the man brings the X chromosome, it's going to be a baby girl. So some school of teachings, Shuttle, Billings method, believe in making love at a particular time to have a particular gender, but we don't promote it in our group because it's not reliable. The failure rate is very, very high. There are so many parameters that can affect the proper outcome of selecting a gender with this. So we don't promote things that won't work, because some people will go and practice something, and if it doesn't work, he will say, oh, Dr. Chudi told me to do this and Dr. Chudi told me to do that. We don't do that. What works and is evidence-based is what you will hear me promoting. Okay, I love that question anyway. All right, guys, 1 more minute and we are done. 1 minute, then we are done. The next clinic is going to be on Tuesday. So my Tuesday clinics will be by 6:30 p.m. My weekend clinics will be by 3:30 p.m. So whichever one you can participate in, feel free and tag along. Remember, there are so many important videos out there you can go and watch and make sure you leverage on what you should know as a member of our community. So my time is up, and I want to use this opportunity to thank our amazing COO, who is always available to help to make sure the group is running smoothly behind the closed doors. And as you can see, she's the only person in attendance this afternoon, and we love you that way. It's okay. So thank you so much, COO, and I'll see you shortly in Facebook. Until I see you, God bless you, and bye-bye for now.